Ona thengia wa thirikari kwarira mibango ya gukinyaniria mubango mweru wa motungata ma urigitani UHC kuri na mathenya maingi thiini wa urigitani maria mangiaga guthingwo ugukorwo uri undu muritu gukinyaniria motungata maria mabatie kuri muingi. Na kurumirira mathenya maya ikuo cia atumia makiheo ciana no ikoretwo ikiyumiria na njira nene kuona hari atumia 10,000 aria maraheo ciana 355 ao nimakuaga na oho imwe cia ciana iria iraciarwo undu uria ucangagirwo ni kwaga ukinyaniru wa motungata.
Our maternal mortality indicators are still high at 355 deaths per 10,000 live births. Health workforce still remains a great shortage and unrest among health workers.
Ripoti ya NDARI egi mathibitari guku bururi-ini iria irarekereirio ni Ministry ya UGIMA wa MWIRI yonanitie wihaririria wa mathibitari hari kuheana motungata atumia makiheo ciana urithi makiria. Kuona na gicunji gia 15 kia mathibitari maharirikite na no gicunji gia 5 gia thibitari iria ire na indo iria ibataranagia hari utungata o wothe ungiyumiria riria mutumia araheo mwana.
Only 15% of the facilities had all the necessary infrastructure required to offer comprehensive services. That is the human resource, the equipment, and the infrastructure. Again, if you compare this with the data that we released in April at the Kenya Demographical Survey, you can be able to see those gaps. No wonder our maternal mortality ratio is still high. Our neonatal mortality rate has not decreased over the past 10 decades.
Na niguo kuhonokia atumia na airitu anini aria maraheo ciana oro undu umwe na imwe cia ciana iria iraciarwo murugamiriri wa motungata ma UGIMA wa MWIRI Patrick Amoth augite uigithia makiria ni urabatarania.
We need to invest more in the primary healthcare facilities so that we can be able to achieve our targets. Most of the gaps in terms of equipment, infrastructure, and human resource is at the primary healthcare level.
Agikindira ati maumirira ma riboti ino ti mbica njega. Minister wa UGIMA wa MWIRI Susan Nakumicha augite giki ni kiambiriria kiega gia gwetha kihonia na njira ya guthinga mathenya. Akiongerera ati unyitaniri makiria ni urabatarania.
Indeed is not a good picture. But I have said before and I will say again. The beginning of finding a solution is knowing and acknowledging the problem, which this report is a clear indication of where the problem is. We need innovative models of partnership between the public and private sectors that can significantly improve Kenya's health outcomes while providing insights for the developing world.
Girifotera Kameme TV ni ejeta wa Wagoi wa Mwiruri.